You have to find a purpose. I think it's you've lost your purpose.
Rick Chorley knew he needed help. A couple of years ago, the veteran paramedic started getting intrusive thoughts, his mood swung, and he wasn't sleeping well. He didn't take time off work, but he did start therapy.
One of the things that came up in our conversation was that I had 40 years to unpack.
Trauma and danger and other stressors like high workloads come with being a first responder. But workers' compensation data obtained by CBC News shows hundreds of first responders in Edmonton have had to step away from duty, spending months off work on average. Approved claims for psychological injuries within the Edmonton Police Service have quadrupled since 2019, rising from 36 to 145. Firefighters have generally seen more claims each year, roughly doubling since 2019, and they tend to spend more time off work than EPS members and paramedics. Claims for paramedics in the Edmonton zone jumped during the COVID-19 pandemic, peaking at 121 in fiscal 2021, before declining through most of fiscal 2024.
Agency and union officials suggest the data signals more people are reporting their mental health injuries and trying to get the help they need.
It is becoming more easy for them to have these conversations. It's more accepted.
Kimberly Bitts from the Canadian Institute for Public Safety Research and Treatment says there's more acceptance now for someone to express what they're dealing with.
We have a greater appreciation for the fact that these things do compound, and therefore that recognition and that reduction in stigma and the openness to dialogue has led to those increased claims, right? Because people are starting to see now that we should be treating mental health exactly as we do physical health, and those WCB claims are equally warranted around that.
AHS, EPS, and Edmonton Fire Rescue Services have implemented a range of mental health resources for their employees, like employee and family assistance programs, peer support networks, and resiliency training. Edmonton Police also introduced a new member to their team, Blaze, an operational stress intervention dog. These EPS officials say no other law enforcement agency in Alberta has a PTSD service dog like him.
As with anything that we do at EPS, it just feels great because it's innovative, and I know for a fact that it's helping our members.
But there are grassroots efforts too. The Alberta First Responders Association, a recently established nonprofit dedicated to mental health and suicide prevention, launched a public online education platform in June. Called First Health, it offers 10 modules that cover things from understanding trauma to better sleep to navigating supports.
When I was struggling, I was in a pretty dark time. I wouldn't say I was suicidal, but I was thinking maybe the world would be a better place without me. So having programs like ours and other programs is super vital.
Rick Chorley is now semi-retired, but still works casually as an advanced care paramedic. He urges first responders to check in with themselves and their peers, and to find a therapist they like just for when they need to talk. He also suggests finding hobbies to ground themselves outside of work. For him, that includes riding his motorcycle. Nicholas Frew, CBC News, Edmonton.